Welcome to Module 4 on mental health issues. This module is part of our hybrid training curriculum for migrants. Recognizing and appropriately treating mental health problems in general, and in migrants and refugees in particular, poses a challenge due to differences in language and culture and the specific stressors associated with migration. In this module, you will learn to identify risk factors and strategies in the approach to self-assessment of mental health and the prevention and treatment of common mental health problems. This module provides an overview of mental health issues among migrants and refugees. We will discuss the challenges they face, the importance of mental health literacy, and strategies for mental health promotion and intervention. By the end of this module, participants will gain enhanced knowledge of mental health issues and available psychological support, improved health literacy, self-empowerment, and advocacy skills, an empathetic and culturally sensitive attitude towards mental health. Organizational policies and programmatic strategies, such as increasing nature contact within built spaces, have numerous health-promoting benefits, including decreased levels of depression and anxiety, better recovery from job stress, increased attentional capacity, and improved psychological well-being. Support cognitive and emotional health through policies, programs, and design. Strategies include mental health promotion, connection to nature and place, mental health services and education, stress management, restorative opportunities and spaces, tobacco cessation, and substance use services. Promote mental health and well-being through supportive programs, policies, and resources. Addressing mental health conditions in the workplace can reduce high turnover, presenteeism, absenteeism, and associated costs. The workplace is increasingly seen as a key setting for mental health promotion. About 18% of adults will experience a common mental health condition, such as anxiety or depression, over a 12-month period, and over 30% during their lifetime. Two-thirds of these individuals are employed, highlighting the need for workplace interventions. Support occupant well-being by incorporating natural environments and celebrating the project's unique identity. Incorporating natural elements like plants and local cultural aesthetics can improve morale, job satisfaction, and productivity. Humans are increasingly living in environments with insufficient exposure to nature. Incorporating natural elements into buildings can support occupant relief from stress and mental fatigue, as well as help establish a sense of place, increase awareness of mental health conditions, and offer supportive services and accommodations. Equitable access to screening and mental health services can encourage care utilization and support early diagnosis. Obtaining appropriate treatment for mental health conditions remains a global barrier. Access to screening and mental health services, as well as enhanced social support and adjustments to the work environment, would be a solution. Promote mental health awareness and education through training and anti-stigma interventions. Increasing knowledge and awareness can reduce stigmatizing attitudes and encourage help-seeking behavior. There is a need for increased knowledge regarding causes and recognition of different types of mental health conditions, beliefs about treatment for mental disorders, and reduction in stigma against those with mental health conditions. Develop a stress management plan by identifying workplace stressors and engaging employees in creating solutions. Interventions can include changes in operations and increased support to reduce job stress. Management teams have an opportunity to engage in a participatory process with employees to assess workplace stressors and develop a stress management plan to reduce risks. Interventions that adjust job stressors, such as changes in operations, increases in coworker and supervisor support. Long working hours and insufficient opportunities for recovery are associated with numerous adverse outcomes, including cardiovascular and immunologic reactions, reduced sleep quality and duration, and increased risk for stress, burnout, excessive alcohol use, and poor diet. Provide spaces that promote restoration and relief from mental fatigue or stress. Incorporating natural elements in outdoor spaces can help alleviate workplace fatigue and enhance psychological well-being. Work-induced fatigue is common among office workers, with research indicating that over 20% of the workforce experiences prolonged fatigue. Introduce mindfulness programming and meditation interventions in the workplace. These practices can reduce stress, improve mood and sleep quality, and enhance overall mental health. Highly stressed employees are at risk for numerous negative outcomes, including decreased productivity, greater absenteeism, increased occupational injury, and higher overall medical expenditures. Support access to nature by incorporating plants, daylight, and natural elements indoors and outdoors. Exposure to nature has been linked with numerous health benefits, including decreased depression and anxiety and improved attentional capacity. Without plants and other natural elements, you miss out on many health and well-being benefits. Exposure to plants and other natural elements has been linked with decreased levels of diastolic blood pressure, depression and anxiety, increased attentional capacity, better recovery from job stress and illness, increased psychological well-being, and increased pain tolerance. Reduce tobacco use through interventions supporting cessation and restricting on-site sale of tobacco. Providing counseling, medication, and workplace incentives can help employees quit smoking. Tobacco is responsible for an estimated 6 million deaths per year globally among direct users and serves as the cause of death for up to half of its users. 35. In addition to those deaths caused by direct use, an estimated 890,000 annual deaths can be attributed to non-user exposure to secondhand smoke. Increase availability and access to substance abuse and addiction support services. Education, prevention programs, and affordable treatment offerings can reduce the impact of substance abuse in the workplace. Alcohol and drug use contribute significantly to the global burden of premature death and disability. Harmful use of alcohol is a leading global risk factor, accounting for 3.3 million deaths per year, or 5.9% of all deaths, and 5.1% of the global burden of disease in 2014. Let's assess your understanding of the material covered. Answer the following questions. 1. Over what percentage of adults will experience a mental health condition during their lifetime? 2. Recent estimates indicate that common mental health conditions are experienced by what percentage of adults over a 12-month period and 30% over their lifetime? 3. Employee stress is incredibly common, with what percentage of workers feeling stress on the job and 25% reporting work as their number one stressor? Here are the correct answers to the assessment questions. 1. 30% 2. 18% 3. 94%. For more information and references, please refer to the sources listed. Thank you for watching. The Health My project is co-funded by the European Union. Views and opinions expressed are, however, those of the authors only and do not necessarily reflect those of the European Union or the European Education and Culture Executive Agency. Neither the European Union nor European Education and Culture Executive Agency can be held responsible for them.